Major assumptions. So according to authors McEwen and Wills, who wrote the theoretical basis for nursing, assumptions can be defined as the beliefs about phenomena one must accept as true to accept a theory about the phenomena as true. Assumptions may be based on knowledge or personal beliefs and values. Assumptions and theories cannot always be tested, but philosophical debate on the merits occur often. Additionally, it is important to consider the nursing meta-paradigm when considering assumptions of nursing theories. A meta-paradigm helps define the intellectual and social missions of a discipline. The main four concepts that define nursing science include person, health, environment, and nursing. Utilizing the four concepts of the nursing meta-paradigm, I will define the assumptions of the transitions theory. The person within this theory is the person going through the transition, which is typically our patients. Patients often experience life-changing incidents that alter the trajectory of their life and force role change. It's important to consider the patient's biopsychosocial needs as they transition because these elements highly influence their behavior. The assumption made related to nursing is nurses are identified as the main caregivers of patients and their families while they are experiencing transitions that affect their health. As mentioned earlier, the nurse is responsible for assessing the patient and family's readiness for the transition and preparing them for it. It is also the nurse's responsibility to identify barriers and address those barriers to ensure a successful transition. The assumptions made about the environment is one's level of exposure to vulnerability. There are several different factors that affect one's environment: access to housing, one's economic status, one's status in society, family support, and the list can go on. These factors can greatly affect someone's transitional period. If the vulnerability level is high, the patient may experience a longer transition of recovery. The last assumption using the framework of the concept of health is the nursing meta-paradigm is the ability of the patient to successfully transition into their new role or identity.